Are you interested in foot health? Do you like helping people? Does mastering a specialized practice appeal to you? Then a career as a podiatric physician could keep you on your toes. Podiatric physicians diagnose and treat ailments, diseases, deformities, and injuries of the human foot and ankle. They treat these problems by prescribing orthotic devices, providing palliative care, and sometimes prescribing medication. They also communicate and collaborate with other medical professionals. Their goal is to help prevent or treat foot-related disorders. To get our foot in the door of this important career, we spoke to a podiatric physician working in Alberta.
Hi, my name is Samir, and I'm a podiatric physician. A podiatric physician or podiatrist is someone who deals with all the ailments of the foot and ankle.
Go right up against there.
So there's lots of different places a podiatric physician could work. For example, I work in private practice, so I have my own clinic. Many others choose to work primarily in a hospital, working in the operating room or working on the floor. Or some podiatrists will go from nursing home to nursing home if they're doing primarily forefoot care or nail care. Others like to work in wound centers where they're just seeing wounds all day long, which is very rewarding as well. When I get it in the morning, I get a quick overview on what my day is from a patient standpoint. So I look at my schedule for the day, see who's coming in, see if I need to review any results, and then I start my day. I see a lot of patients, so the times can be sometimes very busy when I'm seeing 35 to 40 patients in a day, and I'll spend my time with each of those patients going through those specific conditions. Some will involve just education, so teaching them about what their condition is and giving them their options. Other patients may require things like orthotics, so making orthotics, doing three-dimensional scans and biomechanical exams and all that fun stuff. And then there's the really fun hands-on part of it, so small minor procedures in the office or some larger procedures, whether we're doing it in the operating room here or elsewhere. It can really have a span, and I mix my day with a bunch of those. Once I'm done my day, I finish up my charts because that's an important part of what we do, and then do it the next day, and hopefully it's just as exciting as the first day.
We're gonna sort of see how that lines up.
I like to educate. So as much as I can talk to my patients and tell them and have them understand what their expectations are for certain conditions is my primary role. The secondary role is then administering all those different treatments. So, whether it is, cutting out a painful callus or debriding a wound, fixing an ingrown toenail, surgically correcting a deformity, there's a lot of different things that we do, but for me, education is primary. There's a lot of different personality traits that can serve people well in our profession. People who have very good hands-on skills is important. Having a good bedside manner, being conversational with patients, being patient with many patients are some of the main characteristics that you may have. When you're in the office on a day-to-day basis, there's different tools we have to deal with all of these things. So blade handle, nail nipper, an English anvil, and an orthotic scanner. Those are just an array of tools that could be used in what we see on a day-to-day basis. Personal protective equipment that's needed for our profession on a patient-to-patient basis is primarily gloves, and nowadays many will wear a mask, but it is not required for what we do.
This little mark has been here for a long time.
To become a podiatrist, there's essentially 3 steps. The first step is completing your undergraduate degree, so 4 years in really any undergraduate degree that you so choose. Then you go on to podiatry school to get your Doctor of Podiatric Medicine. Once you complete your 4-year Doctor of Podiatric Medicine, then you have to go through your 3-year residency program. Under Alberta's Health Professions Act and Podiatrist Professional Regulation, registration with the College of Podiatric Physicians of Alberta is mandatory.
Sometimes associated conditions.
The nice thing about our profession is you can really choose what you want to do. I chose to go into private practice, so I had a lot more control of my hours and what I wanted to do on a day-to-day basis. We have many people who are going into the hospitals and want to work there, and the way they like to advance their career oftentimes have the opportunity to do so is to get further up into the research side of things, so they can do more research in foot and ankle medicine or diabetic limb salvage. Because it's such a subspecialty in medicine that many people don't know about, the opportunities are vast. The most satisfying aspect is when someone walks in with something really bugging them, and to provide a solution in about 5 minutes that allows them to walk out the door pain-free. That is very satisfying because you've done something, you can see it, they can appreciate it, and it really feels good when that happens.
To put your best foot forward in a career as a podiatric physician, you need to have physical strength, good eyesight, and manual dexterity. An aptitude for science and an interest in using instruments and equipment for precision tasks is also essential. If this sounds like you may hit your stride as a podiatric physician. Step up and find out more about this occupation, including training requirements and salary ranges, in the occupational profile on the ALICE website. While you're there, check out some related occupations, including chiropractor, dentist, and reflexology therapist. Explore the possibilities. Go to alice.alberta.ca.